So just a little bit about us. We're a social enterprise. We're a community interest company. So although we need to make a profit or a surplus, that's reinvested back into our community, all the services that we run. When I helped to set up First Community, I think I'm probably a little bit worn out, I guess, by traditional hierarchies in NHS organisations, where you had the board or the senior team and these layers of management coming down, and there was the clinician and the patient sort of and the community sort of, you know, here in the bottom. So I was absolutely determined to turn the hierarchy on its head. So it was all about the patients and the public, the clinicians that interface with those, and then actually a very small management team which is there to support that function. And our other unique thing is that we're actually staff-owned. It's a nominal pound. They don't actually part with any money, but it's actually having a stake in the company. We have lots of staff events where they will actually tell us how we can do things differently. So in First Community, we decided to look outside of healthcare practice and see what other organisations do. And organisations like Google, like Innocent Smoothie, Handelsbanken, to name but a few, have adopted the Happy Manifesto in their workplaces. And it's just 10 principles for a happier workplace. I'm sure most of you do a lot of these things anyway. So the one thing I wanted to talk about that we've really embedding across First Community is about pre-approval. And I'm sure you recognise all of these things. If any of you have done any management courses or leadership courses and you go, what's the difference between leadership and management? These will often come up. Do you recognise them? This is what makes a great manager. So good communication, a clear vision, integrity, decisiveness, and also a good coach, supporter and listener. And interestingly, CQC will look at least 1, 2 and 3 as a measurement when they come into our organisations. Most people are happiest at work when they're trusted and given the freedom to do the job their way. So the principles then of pre-approval, giving people the freedom to do the job the way they want, is they come to you with a problem and you give them some clear boundaries. So that might be, this is your budget, this is the time you have to do it in, you must include patients or the public, whatever, but you set the boundaries. But what it does is if by moving away, you stop the micromanagement and it fosters responsibility and ownership, and then the byproduct is the pride in the job. Mistakes might be made, but you learn from those and you move on. And it does increase job motivation, and it will have a positive impact on culture because people are truly empowered. We've tried to incorporate our patient feedback. We really study it and we synthesize it. So we really triangulate that with other KPIs, other performance indicators or other intelligence that we receive. So since we've been working with I Want Great Care, we've had nearly 15,000 reviews, but our average score for FFT is 4.86 out of 5. And we've been working with Neil and the team in getting our registered nurses onto I Want Great Care profiling for individual patient feedback. Now, this is Wendy. Wendy is one of our heart failure nurses. But anyway, this is what patients say about Wendy. And month upon month upon month, 100% feedback. But then all of a sudden, we got a bit of a blip. Patients were coming in. In the GP practice, they were sending the patient downstairs, just into this sort of labyrinth of offices and corridors, didn't really know where they were going. And in the other clinic, they came in and were sent upstairs, and again, a labyrinth of offices and corridors. And so it was creating an awful lot of anxiety. So Wendy said, I've got a problem, and we just said, go and solve the problem. Again, set the boundaries, haven't really got any money, but just work with the people you're working with, talk to patients, what would make a difference. So she worked with the practice manager in the practice she was at. She worked with the consultant and the GP and the echo provider, and she came up with this board. And the help that she got was getting it printed. So it really was very little cost. And that was last month, so we're back up to 100% again. And she's had no more no more complaints about waiting times, because now they all understand exactly what's happening. So it's a real positive story. So by improving patient outcomes, I would say just let go. It liberates everybody. It certainly liberates me as a manager, and it liberates the staff and really empowers them to deliver excellent patient outcomes. Thank you.